Does anybody have any questions, or I can kind of get the ball rolling? Hand raised. Charlie, anything? Actually, I have a question for Izzy. What started, when you mentioned you came back second semester with like a totally different mindset, what happened? Like, how did you get that mindset? Did you see somebody? Did you start a medication? Or was it really just kind of a mental thing you did with yourself?
I think for me, the biggest step was right before I left for Christmas break, and I recognized that like I just was dreading coming back so much, and I was like, I can't come back. Like I was like, I won't go back if like I don't have something to look forward to. And I ended up actually having a pretty honest conversation with my coach, and like I said, I love her. And she's made all the difference in my experience. But even that conversation, I mean, I think I honestly could have talked to almost everybody, but coming from someone that didn't necessarily know you previously before, like it's always easy to get advice from my family or my friends being like, we love you, you're enough, blah, blah. But hearing my coach be like, well, this is what we see from you and we value from you and I want you to be happy. And I think from my experience, like, this is a lot more normal than you think it is. Like I've seen girls that this has happened to many, many times. And I honestly think that conversation switched up my mindset a lot. I think could have been anyone, but just, yeah, seeking out help definitely made a difference for me.
Great. All right, so so I sent out some questions or a survey to some people who registered early, and I have a list of questions that people want to hear. So unless we get a squeaker out there, I'm going to go with these questions. So how do you determine if someone has an eating disorder and needs to see a specialist versus someone who's just trying to stay healthy or trying to lose weight? How do you tell when there's a pathology?
Well, first, it's very complex. There are lots of different presentations of different types of eating disorders and disordered eating. And to echo one of the other panelists, you don't necessarily have to meet criteria for an eating disorder to meet with a professional and share your concerns and share your experience to get more feedback on what you may be navigating. So I like to tell clients that if a significant amount of your mental energy is preoccupied with food, exercise, weight, your body image, and it's taking up a significant amount of space where it's taking away from the other things in your life that are important to you, absolutely, that's an indicator. You need to talk to somebody about that. A trusted healthcare professional that maybe already knows you, like your pediatrician, or somebody that's available on campus, and they can help guide you in ensuring you have the support that you need, whatever that may look like.
Thanks. What are the dangers of Adderall misuse or sharing? Does it mix badly with alcohol?
Yeah, so, I think I hear about this phenomenon often. Someone will come to me and say, I think I might need Adderall. I tried my friend's Adderall, and, or I got this from, my mom or my mom's cabinet, whatever. Sharing Adderall, any stimulant medicine, they're controlled substances, so it's technically illegal. So it's like a federal crime to give your Adderall to someone or to take it as someone who's not prescribed it. So, that's just the first thing. But second, it's also really unsafe because Adderall can affect your heart and the way it works. And so someone who wasn't prescribed that and sort of properly worked up medically, you don't know that that's going to be safe. So, you can have a bad arrhythmia, you can even have basically a heart attack. And also it can create a lot of anxiety in someone who hasn't been properly evaluated to take it before. So it's not a good idea, and mixing it with alcohol is just sort of kind of two different substances that affect your brain in two opposite ways, and one is an upper and one is a downer. And so your brain's getting mixed signals, I'm drinking, I'm getting tired, stimulant, I'm alert, I'm awake. And you can't actually feel the effects of alcohol as well. So instead of feeling drowsy and slowing down on drinking, you might actually feel like you're alert and fine and not impaired and keep drinking, which can put you at a risk for blackouts, alcohol poisoning, a lot of other things, bad decisions, risky behavior. I think that that's a dangerous combination. You're really like playing tug of war with your brain as well as like your heart, for example. So I really discourage people from mixing those two. If you're going to study, then take your medicine to study and then let it wear off before you might go, have a few drinks with friends. But mixing the two, and that includes even like stimulants like caffeine, Red Bull, Celsius that, is so common. You might not even think about mixing those two, but it is problematic, and in the long term that can really cause some bad effects on your brain, like anxiety and insomnia that can get you to a really bad place. So.
Thanks. Question?
I have a question to all the doctors in the room. As a former college student, that I've seen multiple psychiatrists and therapists throughout my school and even up until this point, and prescribe them heavy medications. How do you determine what you really need?
So just to reiterate, if you didn't hear that, so Jenna's question was, when you feel like you do need a psychiatrist, how do you find one that is suitable, like fits with your style? And I will say too, Jenna, I think some psychiatrists primarily focus on medication, and some also do a little kind of counseling too. So how do you figure that out when you're looking at somebody's website?
I think that's a really great question, and just like you touched on, like if the rapport you have with that person is going to be so incredibly important, and your trust in them, how you respond to treatment. And so I think you really bring up a really great point. I think sort of similarly to finding a therapist, trying to find someone with a similar approach to what you're looking for can be really beneficial. And a lot of us have websites or Psychology Today profiles that speak a little to sort of our approach, and like if we do only med management, or there are some psychiatrists who actually don't prescribe and just do therapy, or if they do both, and if so, what kind of therapies they offer, and how long their appointments are, right? There's a really big difference between going somewhere for, and not that there's anything necessarily wrong, but like a 15-minute med check versus either 45 minutes in some locations, and trying to find a style that works for you. Similarly, like reading a little bit about them and their background. I find that this is the case too when folks are asking me about looking for therapists, just because everyone has different experiences and expertise. And so I would say that on the front end can be beneficial. And then too, when you go, trying to convey what you're most interested in and make sure you guys align can be very helpful. And while it's hard when you first meet someone, being honest as much as possible about your past trials and what's been helpful and what's not. And feel free to advocate for yourself, right? Like why you think something, because we want to hear truly. But I think sometimes like anything, if you feel like it's not a good fit, there's other folks out there who might be a better fit, and it's okay if that happens. And
I'll put a plug in too, I think for Dr. Frenchman in the group. A lot of times you can start with your internal medicine physician, because sometimes internists, pediatricians feel comfortable prescribing those meds. And if they don't, they sometimes know the reputation of the psychiatrist. Well, hey, I know Jenna, she's going to need and work well with Jennifer or whatever. So I think a follow-up question to that, because I think a lot of people oftentimes will hear about the testing, the genetic testing. So why do I have to wait 3 weeks on Zoloft to figure out if it works or not? Why can't they just do this genetic test and figure out which medicine I need right away? So can one of you guys comment on that?
Yeah, sure. So there's genetic testing that is kind of hyped as like helping you find the right medicine, but it's definitely more of an exaggerated benefit of that testing than is actually true. So in terms of like evidence-based, like what the testing actually shows is how you metabolize the medicine, and not necessarily which medicine is going to be right for you. But the way it's presented is a little confusing because it's put into a green light, yellow light, red light category. And so, someone will bring me their testing and say, well, what do you think I should take? And I might suggest something in their yellow category. And oh, but why? Why not in the green? So it really isn't showing you which med is best. In fact, sometimes the medications in the green column might be harder to tolerate, or they might be sort of like this stronger second line that you wouldn't want to start first if you could get by with a sort of gentler first line medicine. So kind of not putting too much weight on those genetic tests is a good thing. Trust your doctor. And you know, I use those results if someone brings them to me, but I rarely encourage them to get that testing because I think, you know, a lot of what we do is looking at the clinical response to medicine, and that really guides us in terms of benefits and side effects. And we don't necessarily need the testing, and it's not often as useful as people wish it were.
That's really helpful, thanks. I have a question from the audience. So what is marijuana-induced psychosis? How common is it in young adults and college students?
That's a great question. So as far as the actual rates of marijuana-induced psychosis, I don't know that I could give a specific number, but I could say anecdotally what I've seen over the past 10 years, at least as far as just as the potency rates of the marijuana, weed, any of the edibles that are out there, as the THC content has gone up, I have seen more and more people coming to my office who are in their early 20s who are saying, hey, part of the reason I'm coming to you is because I met with my psychiatrist and he says I've had some psychosis-like symptoms, and so I should probably talk with you about that. And you know, 10 years ago, I don't think I had ever experienced that, but that's, you know, maybe every 6 weeks somebody's coming into my office saying something along those lines. And just in general, going back to the marijuana piece, I mean, the potency, if you go back, let's say 20, 25 years ago, the average THC content of, you know, a joint might have been 2 to 5% THC content. The average of a joint now is in the 20% range. If somebody is doing something like, if you're doing edibles, it's typically much higher than that. If you're doing things like dabs or if you're doing vaping, it could be as high as 80% THC rates. So the potency is just off the charts, and as far as what that can do for people who may have some of the genetic traits for psychosis in their families, it's kind of like it activates it. For some people, not all, but the risk is high, or higher than it used to be, certainly. And if you go to Colorado and you look at the warning labels, that's the first thing on the warning labels in dispensaries is risk of psychosis. So.
Is that a chronic thing? I mean, I know it is increased risk of schizophrenia in some people who might be genetically predisposed, but is the psychotic symptoms go away, or is that something that's more of a chronic thing that can require medication?
I've heard different things. I've known some people who, if they stopped using it, then sometimes the symptoms would go away, and then I've seen other people where once it's on. It's like a glow stick. So I don't know that there's a defining characteristic of it other than the risk is there, and it's a much higher risk than most college students are aware of. And if people come in my office, they usually think that I'm overhyping it, but I'm just telling you, yeah, good question.
What are the risks of THC intake for those who are not predisposed to psychosis?
Risk of THC intake for non-psychosis, I think just in general, if you look at all of the studies that are coming out, the most recent data, overall just the impact of what it's doing to brains, because as a culture we've never seen THC levels as high as it is. That's where people are looking at studies coming out of Denmark, and what they're looking at is kind of the overall impact on the brain. They're noticing some areas of the brains that are not responding as well as they should, less activities in certain regions of the brain. You know, as far as one of at the risk of going overboard with it, there's a compound that your brain naturally produces called anandamide. And anandamide and THC look very, very similar. And anandamide is one of those compounds that your brain needs in order to, you know, provide happiness or contentment. And if there is THC in the brain's not going to produce the anandamide. And so that's where you get a lot of people when they're stopping weed, and they will comment that, well, nothing's fun anymore. I don't enjoy movies anymore. I don't enjoy video games. Everything's boring. And it's because their brain is no longer producing the anandamide because of the THC.
Interesting. Question?
Can you talk about the normalization of binge drinking on college campuses?
It's a great question. So Sarah wanted to hear about the normalization of binge drinking on college campuses.
At least just from my perspective, what I've gotten to see, again, kind of over the past 10 to 15 years, it just feels like, and especially with social media, it has completely amped it up. I see college guys coming in a lot of times, and especially if they've had kind of the overlay of Greek life, their perceptions as far as what would be considered healthy or over-the-top drinking is completely distorted to the point where, again, it's created the perception that blacking out is not a problem. And in general, 10 to 15 years ago, that was the type of thing where people would, if I was seeing them, they would come in and say like, hey, I blacked out. What does that mean? And now blacking out has almost become the target destination for a lot of people. And so it's just kind of amplified the normalization of, oh, well, this is totally normal, totally safe, and it's not risky. And it's just, that's at least just what I've seen in my office.
We had a card, and that, just to segue into the Greek life, I guess, what advice, I mean, because I don't know if this is the right group, but like this is hazing and you got to drink this and do that. Like, what is somebody to do? What's the response if you don't want to participate in that, but you still want to be a pledge or whatever?
That's a great question. I don't completely have the answer for it. I have definitely seen guys who are in college who, like, if they know they've got a family history of addiction, which lots of families do, and yet they were interested in Greek life, and then when they came back at the end of their freshman year, and they're telling me, hey, on a football Saturday at an SEC school, I was pressured into consuming 30 beers and vomiting and then going right back to chugging more beers. I mean, and that is several of the SEC schools. I've heard about it at a lot of the Big Ten schools. So I just see it kind of all over the place. And I think if you're interested in Greek life, you have to kind of go into it with your eyes open, as far as that there is a decent chance that that's going to be a big component, and that may not align with kind of your values or how you want to live your life. I would also add into the mix, though, there are lots and lots of people that are not doing the binge drinking. I think it's really easy to have the expectation of like, oh, well, you go to college and everybody's drinking and everybody's blacking out, and that's also not true. But the social media certainly is kind of amplifying it, normalizing it, and in Greek life, it's on steroids and it's out of control.
I can kind of I'll talk about this from a male perspective, and then maybe Izzy from a female. I'll keep it to a minute. I would say this is the best example that I could give of social isolation, hear me out, being a good thing. And I don't mean that you need to isolate yourself and be the only one not drinking, but it being an opportunity to grow in character when you feel peer pressure and trust that the person in front of you who is, calling you out for not drinking, for telling you you're a wimp for not drinking. I have seen those friends of mine now have alcoholism in their adulthood. And I've seen people nearly die because of what they've done when they're drunk. We've had people die because of what they've done when they're drunk. And even if you don't go to that extreme, you watch habits deteriorate. It's what happened in college. So what I would say is there are people in your communities, both from the male and female side, that get that and get that at a young age. And it might take a little while to find those people who realize that, hey, you can be cool if you don't drink till you forget, right? We can have fun if we don't drink till we forget. But you gotta have some patience with that. And you can stand up for yourself in that scenario, and there are ways to navigate it.
Yeah, I would say, I go to a school where Greek life isn't really like a thing. And honestly, I would say that I don't see as many of the peer pressure to drink and certain in situations and hazing and stuff as bad. I'm sure there are places you could find it on campus, without a doubt. But I think in looking at schools and that's something to think about. I would say from a girl's perspective, I have many friends at many different types of schools, and I would say from my experience, it's significantly worse for boys. I have a girlfriend and a boyfriend who both go to a big state school down in Texas, and their experience with Rush versus pledging was completely different. And I think the saying no there's not even, I don't think girls as much see the pressure to be drinking and doing stupid things when they're drinking. I think guys definitely are more prone to getting like falling into that pressure or being told to do things like that. But like Jackson said, I don't think anything's worth putting your own health at risk. And at the end of the day, it pretty much is illegal. So to say no to anything, there's nothing wrong with that because they can't really do anything to you because they're only putting themselves at risk by trying to make you do things that you don't want to. So I think that's important to know.
One of the things that we talked about at our team meeting this week was why people drink. And so we talked about, is it just experimenting, or are we using that to help cope with, for example, social anxiety or other things? I mean, how do you know when you're abusing alcohol to deal with negative feelings or emotions versus, hey, I'm just in college, this is what college kids do? Can you comment on that? Anybody? Amy or Amy's? Right, yeah.
Yeah, so I guess we're hoarding the microphones on this, talking to both of them. I would say that if you think about it, there are a lot of different functions. What we would say is, like psychologists, we would say there are a lot of different functions to things like drinking or doing any kind of group activity. Are you doing this to socially connect, or are you doing it to sort of run away from something, an internal experience that you're having? A lot of people talk about alcohol as a social lubricant, which is kind of a weird term, but just this idea that, if you're nervous and you have a little bit of alcohol, that might loosen you up and you might do a little bit better around people. And like Ben said, over time, the more that you're kind of using alcohol as a means to run away from emotions, you're doing a couple things. You're not giving yourself a chance to really process those emotions and to be able to work through them. And so somebody who has what we call like subclinical anxiety, I'm just a little bit nervous, I'm a little bit anxious, over time, with more reliance on a substance like alcohol or something else, that's going to actually build up. And then, like Ben said, when you stop drinking or you no longer have access, it's really hard, you're going to have that rebound effect. So I would look at, why am I doing this? Am I doing it to avoid an experience, or am I doing it to really join and connect?
And one of you on this panel explained to me earlier about neuroplasticity, right? So if, especially at this particular age range up until, 25 to 29, if, as you brought up, Amy, that if you don't learn to cope with those negative feelings in a positive way, then your brain does not learn to develop, right? So it's a lot more important almost in this age range than, for example, if you're older. Would that be fair to say?
Yeah, and I'll jump in just real quick to answer one of the other points, the question about like weed and long-term effects. If you got to be a fly on the wall in my office and got to see the guys who are between the ages of 20 and 35 who have been pretty consistent weed users, they have become what I would term like emotionally fragile. Like if they have experienced any kind of emotional discomfort, or if something was hard and then they made the connection of like, oh, well, if I smoke weed, I feel better. That is where they have learned to rely on using the weed to deal with uncomfortable feelings, but they are lacking kind of that resilience, and it has made them fragile and incapable of handling just any kind of difficulty that comes up in life.
The college students. Everyone wants to see y'all be safe. Everyone wants to see y'all be successful. Nobody is there wanting to primarily get you in trouble. So primarily adults on campus want to help first. And so if your RA is someone that you would trust, yes, that's a good resource. But so too are the counselors on college campuses, and all colleges have them now. They all have counselors, and you can go to talk about your friend. You don't have to go to talk about yourself. You could go to get advice about how do I help this friend. You could talk to a professor, an academic dean. If you're in this sort of unsafe situation and you don't know what to do, campus police. Again, they're not there to get you in trouble. They're there to keep you safe. That's kind of the nice thing about college. It's a soft landing of like adulthood and the real world. Everyone knows you're figuring it out. Young people figuring it out, and they just want to help. So I think that, and then also, I don't know if y'all have heard about 988. So
ask about you to comment on that. Great.
You can text 988 or you can call 988. And you don't have to be in some crisis situation. It doesn't have to be about you. You will be connected to a licensed counselor who can give you advice. And it's all private. They're not going to report it to anyone, anyone at college or parents, anything. And you're not going to have like emergency services called unless there's truly a really unsafe situation going on. And that's like only 2% of calls that they get. So again, you can ask them anything and you can get good guidance. So there are lots of different ways to go about getting support, but the main thing is don't worry alone. You don't have to worry alone, and that stress is so heavy. And there are ways to intervene and be supportive.
Thanks. That was going to ask you about 988. Does everybody know about 988? It's a real. I did not know about it until after Owen's death, actually, and I've had people comment about texting and getting some really amazing resource support. So I highly recommend it.
And can I add one more thing?
Mm-hmm.
It's kind of in addition, like say you had like a friend who's really drunk and you're worried about them, like are they gonna like be okay through the night, like are they breathing okay, are they are you gonna have to watch them all night, even if you've been drinking yourself, even if you have been participating in these activities and you're worried about getting in trouble, don't worry about that. Again, it's everyone wants to see you safe, so you can call campus police, you can get your RA involved, you can go to the hospital. There's something called medical amnesty or the Good Samaritan law where you are protected, because no matter what you have done to your friend in getting them help, you are protected from getting into trouble. And
So let's repeat that. So if you're at a party and you're worried about somebody, but you're an underage drinker, you can call the cops and you have medical amnesty.
That's right.
Okay.
You're not going to get in trouble. Your friend's not going to get in trouble. They're going to get medical help. You might later get a call from like a college counselor just to check on things, follow up. Your friend may too. But that's so much better than another situation where you might not have your friend in the morning, or you might be having to call their parents and tell them something really awful. Just go get the help. You're completely protected from getting in trouble.
Great. Jackson?
Yeah, just on the medical amnesty thing, like, I've had to do that, and I've had to essentially get a friend in trouble with the risk of, if I don't call the ambulance, he could die. And I promise you, the phone call with his parents and with him was nothing but thank you for what you did. So even if there's some form of repercussions that we haven't thought of, every person in that person's life, including that person, will be thankful that you did the right thing.
Thank you. Great. Any questions you guys have? So, Catherine, I wanted you to talk a little bit about body dysmorphia. I mean, of course, Owen had BDD, and a lot of times, I guess just in body image itself, you and I talked before the event about what to say to people about their, or what not to say when someone has OCD related to BDD.
Yeah, and I'd love Amy, Dr. Mary Askin, to comment on this as well, because body dysmorphic disorder is a form of OCD, and an individual can have body image concerns or body image struggles and not have body dysmorphic disorder. So those can be two very different things. But back to your question, Liz, you asked just to speak to that?
Well, I just think a lot of times, even if somebody doesn't have BDD, for example, on social media, you look so pretty. I love that. A lot of physical comments, whether it's, especially if someone has a body image issue, if we constantly feed them about, you look so skinny. Oh my gosh, what diet are you on? Tell me what to say and what not to say. And this is for men and women.
Yeah, absolutely. So I think, at the end of the day, we want to give compliments on who a person is and not solely about their appearance. Certainly that doesn't mean we can't say to somebody, I love your dress, or you look great, or you look pretty, or, but I think just being aware that our comments, we don't know how they're gonna land for that person. And you cannot tell just by looking at somebody, you can't know whether they are struggling with how they're perceived or their body image. So if you are telling somebody, oh my gosh, you look great, and they are really maybe struggling with some unhealthy behaviors around eating or exercise, that's going to send a message to them like, oh, well, I have to maintain doing this, right? So I think really, again, in the big picture, we just don't ever really know what's going on with somebody. So when we can, we want to make comments, whether it's on social media or in real life, about the person and who they are and what they bring to that moment or your relationship, and not solely about appearance. Amy, anything else you'd like to add? You have a mic.
Well, I agree with all that. I think that's wonderful. I think as well, when you're looking at something like body dysmorphic disorder, whereas body image concerns tend to be more global, they might be about like weight or shape or things like that. With body dysmorphic disorder, it's a little bit different, where it tends to concentrate, usually kind of shoulders up, but not always, but it really hones in on like one aspect of appearance. And that aspect of appearance is something that is to others, they don't see that there's any kind of like flaw, defect, anything like that. It's not perceptible to others, but it may be something like, I'm so worried about my hairline, I'm worried about my acne, I'm worried about my nose, and then there are these behaviors, they're kind of like compulsive behaviors that people do over and over and over again, like looking in the mirror, or avoiding the mirror, or taking a lot of selfies to check your face, or doing grooming, using a lot of skincare products. And this ends up taking up a lot of time. It doesn't mean, if this is something that you've experienced, it doesn't mean you're vain. It doesn't mean that there's anything other than BDD is something that makes a lot of people suffer, more than we initially thought. So you've probably heard about OCD, and that's about like 2% of the population. There are some studies showing that BDD is about double that, maybe even more, depending on what setting you're looking at. And the pressure that y'all have at your age to, you know, look a certain way, or like I just learned about like looks maxing. I'd never heard that term. Like this is like a BDD factory. But anyway, those are the kinds of things that, you know, when people end up pursuing things to make themselves feel better, like let's say you do go and you get plastic surgery, you actually end up feeling worse. So it doesn't sort of fill that hole or that desire to look better.
I mean, I think speaking of OCD is, you know, we've all seen people who, you know, wash their hands incessantly or have these like behaviors that seem pretty odd to us. Is there something we shouldn't say to these people when they're doing this, or they were seeking reassurance, or we should? Do you have any advice about dealing with people like that?
Yeah, I would say if there's somebody who you suspect has OCD and you're seeing repetitive behaviors, know that 99% of the time people with OCD know that it's irrational, and that's part of the pain of it. So they might say things like, I know I can't get sick from touching that doorknob, but I just feel like I have to wash just in case, and now I have to do it again. So I think coming to them with non-judgment, just saying like, hey, I've noticed that you're kind of getting stuck here. Is there something that I can do to support you? Is it something where, have you talked to somebody about it? And that would be if it's like an overt or visible kind of compulsion. Sometimes people with OCD have mental compulsions. They're having unwanted thoughts that kind of just go into their heads, like I'm looking out here and I think I could just impulsively throw this microphone at one of you, right? Like I don't want to, but that's an unwanted intrusive thought. So I might be doing things internally to kind of turn down the volume on that. There's great treatment for OCD. Ben does a lot of work with OCD too, so I don't know if he has anything that he wants to add there, but yeah, I would say non-judgment, and don't come at it with logic. Don't, oh, you know you're not actually going to get sick, because they'll say, you know what, I know I'm not going to get sick, but I feel like I have to, and there's shame in that.
Mm-hmm. One thing I wanted to ask, Abby's in the back, and she kind of developed these test strips for spiking drinks and that kind of thing. Abby, you want to kind of talk a little bit about your product and how we might utilize that, and we're worried about drink spiking and things. Yeah, are you sure? Yeah.
So we've partnered with a leading pharmaceutical company in the UK, and we have clinical grade test strips that can detect common date rape drugs. The most common are GHB and ketamine, but it detects a variety of different amine-based drugs like ketamine, scopolamine, cocaine, other similar drugs in just 15 seconds. It works in most drinks, alcohol, non-alcoholic drinks, and you basically just take a bit of your drink with a finger or a straw, you rub it on the test strip, and if you see a color change in just a few seconds, then your drink is spiked. And something we really wanted to tackle is, number one, college students aren't really comfortable bringing very obvious like drug tests, drink covers things like that to parties because of the social stigma, peer pressure to not really care about those things when you're at parties. So we wanted to make sure it was as discreet, customizable, make sure it doesn't look like a drug test at all. Another thing is that over 90% of drink spiking cases go unreported. Drug-facilitated sexual assault goes unreported, especially because underage drinkers who are binge drinking feel guilty. And once again, they'll feel like if they tell anyone, like campus police, they will get in trouble rather than the person who inflicted the crime. But with these test strips, you can use them as evidence with law enforcement and hopefully get your offender held accountable so they don't keep doing it.
Thank you. Yeah. Question back there, Maya? Yeah, so I mean, Jackson, you commented on a little bit about peer pressure. I don't know if, what are some practical ways to respond to peer pressure with whether it's alcohol or drugs or other things?
Yeah, I would say that the first thing is you have to identify sometimes the person that's trying to do that for you. So like first there's like the crowd pressure, right? I don't have a drink in my hand, right? And I'd say that that's a hard one to deal with, but there are ways, Izzy and I both, our mom taught us, and like there's always ways you can like go get a drink and either dilute it with water or drink anything, and no one will ask you about that. And so if that's an issue, I'd say that's a practical thing you can do. If someone is pressuring you, like I said earlier, that's a chance for you to stand up for yourself. And so I would identify when you get to campus, like the friends that you go out with, going out with people that like the people who can have your back in that type of scenario. And it's your first time as an adult, stand up for yourself and say like, look, I don't want to do that. And then you're gonna kind of sit with an uncomfortable moment, and you might deal with an uncomfortable moment, but those become more and more frequent as you become an adult, and you just kind of learn to swallow that. It's gonna suck for a bit, but it will be better in the long term. And the last thing I'll say is you rub off on others when you stand up for yourself. So a lot of times people have a hard time with a lot of these things because they, like, oh, I'm fine, right? But all of you, if your sibling or your family member were in trouble, would go to back them up, right? You would do anything for the people you love. And so when you go to campus, you have an opportunity to have an influence on people that they might remember. So that person who's pressuring you might be hurting. They might be engaging in a behavior that's really bad for them. And while you might never recognize the impact that you have by, standing your ground, I promise you it's going to happen, whether it's immediate or something. And that's
Ben, you also gave a pretty good example on a different. Do you want to tell me?
Yeah. So for the first 2 years that I was in college, was on the crew team. I did it for all 4 years, and the crew team where I went, they were pretty renowned for doing parties and things like that. For me, really the biggest thing was like if I went to the parties and I showed up, and inevitably if there was a keg on the back porch, but I didn't drink, and my usual response was, I'm good. And especially like if I had a red Solo cup in my hand, then it just functioned as a prop. And for the people who are your friends, I tell people in my office all the time, they just want you there. Like as long as you're there, that's kind of the most important thing. And even if somebody's like, are you sure? You sure I can get you here? It's like, no, I'm good, man. And usually after the second time, they drop it. And so if you, when I was saying, no, I'm good, it didn't feel like I was having to really stand up for myself. It was more just like I felt comfortable with that, and it was, nobody ever judged me for it. I never felt judged, and that's been the experience. Like when I've encouraged other people to try to use that approach of having the cup as a prop, and they'll come back over Christmas break and they're like, hey, I tried that and it actually worked really well, and nobody actually cared.
I think it just closes it down. You're like, I'm good, close it down. Yeah.
I think I was just going to add on to that. I was just saying this earlier to you. Like, from my experience, a lot more of the peer pressure coming that you think you feel is like actually self-inflicted. Like, people don't actually really care. I think I'm like not speaking to the situation of like things with like hazing and stuff, and maybe like pledging, but like from my experience, I haven't seen any of that. But even I have like very good guy friends at school, and one of them doesn't drink. He doesn't drink at all. He never has. And no one questions it. He doesn't even need to hold a drink at a party, and people actually are like, oh, that's really cool. Like, I think a lot, people kind of make, and I think social media does this too, making it seem like if you're not drinking, people are going to judge you. Like I said, like he said before, like usually if someone's offering you a drink, they're just kind of trying to be nice. If you're like, oh no, I don't really want to drink, or honestly, the amount of times I've used, if I'm not feeling good and I'm like, it's not a good idea for me to drink right now, I can be like, oh, I don't feel well, I was sick last week, oh, blah, blah, blah. Oh, I think I'm having an early night, I have practice tomorrow. Like, it is so easy to say those things, and people really don't question and are really just kind of thinking about themselves more than you think. So I think it is important to recognize when you feel that pressure of like, people here like don't think I'm cool because I don't have a drink in my hand, or I'm not drinking, or if I need to drink to like have fun. That's not true, and I think people care a lot less than you might think that they do.
I have a question that's shifting gears for athletes. Is there a supplement that is over the counter that athletes should absolutely avoid as far as performance enhancing? I mean, how do you know what supplement could be really harmful?
Well, first of all, there are multiple supplements that are available over the counter. They are not regulated by the FDA, so unless there is, third-party testing from a reputable organization, you don't necessarily really know what you're purchasing or what you're ingesting and how that may interact with any other medications you're taking, whether they're prescribed or over the counter. So I would say if you are considering any type of supplement, it's best to discuss that with a trusted healthcare provider that knows you. Not necessarily somebody that, has a reel on TikTok or on Instagram, even if they're an MD or, a dietitian. They can be great, but their advice may not be unique to your specific circumstances and needs. So I would say always have caution. Talk about it with your trusted healthcare provider.
I think the most common would be creatine. Would that be, you guys can nod your heads. Or is there anything else we should address other than creatine? A lot of people talk about that.
I would just add your trainer. My trainer was amazing in college. She's always like, no, yes, yes, no, yes. So another good resource.
Perfect, thanks. What else? We're at 6 o'clock. Does anybody else? This is
Experts, you guys have any other questions? What we thought we would do, I have a couple of questions that are in the back that maybe if we could get you all to consider answering on our Instagram account. So maybe I could float you a question, you take a video of yourself. With that, if there's a question that you have or you think about that you want addressed, if you could fill that out and pop it in the, is it on the baskets on our merch table? Yeah.
I have a question.
Sure.
Since we're talking about supplements and all those things, what about caffeine? Because I feel like it's a really big thing, because everybody always has caffeine drink, and people are drinking like multiple a day, and I just don't.
One of our cards is a Starbucks gift card.
Whoever does that, can they tie that with sleep too? So tie it.
Yeah. So caffeine is a really popular substance stimulant. It is a stimulant. It's a very messy stimulant. It has lots of metabolites. So when you drink coffee, those metabolites build up in your system, and even when you can't feel the effects anymore and you think it's out of your system, it's still affecting you. So in terms of sleep, that's something that like you could think, well, I drank my coffee this morning. I don't know why I'm having trouble sleeping now. The coffee has metabolites that can last until then, and each day that you're drinking it is building up more. There have been studies around like maximum safe caffeine intake because drinks like Celsius, these monster caffeine drinks, they have so much, like 200 milligrams. There was a study recently that found that 400 milligrams of caffeine, and you can almost guarantee you're going to have a significant anxiety issue. So, really being being deliberate, being intentional about how much caffeine do you really plan to ingest, what are you ingesting. Honestly, I'd highly recommend like tea over coffee. It's much less strong. I think that is really important. Caffeine can just make you feel like jittery and off and anxious, certainly interfere with your sleep. And sleep, I know y'all have heard sleep and how important it is over and over again, but it's one of the biggest challenges you'll have in college because there's so many distractions, there's no structure, there's no one checking in on you. Any kind of structure you give yourself is going to come from you around your sleep. And one of the best things you can do for yourself is try to have a regular-ish sleep time and wake up time. And that will help you so much in terms of how you feel the next day, are able to learn and remember things, cope with challenges, enjoy things socially. So in general, I'd say less caffeine is more.
How much does Celsius have out of
200?
200,
Yeah.
okay. Okay, Jackson?
Yeah, I want to add a question, another follow-up. Can you talk a little bit, or someone talk a little bit about the cycle of, I'm tired, I need to study, I need to perform, so I need caffeine, so I'm up late, so I don't get sleep, now I'm tired again, and that vicious cycle that college kind of pressures.
I'll speak to that for just a minute and then pass it on. I think an important thing to consider there is when you're tired, you need sleep and you need energy, and energy comes from nourishing yourself. And back to caffeine, that can really disrupt our hunger and fullness cues and our ability to assess when we need to eat, how much we need to eat. So for individuals that are consuming copious amounts of caffeine, that can really confuse that aspect of your self-care. So I just wanted to add that.
To add to that, actually the insomnia plus caffeine together is a perfect recipe for psychosis. So hallucinations, like audio-visual hallucinations, delusions, getting paranoid about things, like that can definitely happen if you get into a cycle of not sleeping and then self-medicating with caffeine. It's very dangerous. And I'd say that too for anyone who takes ADHD medications. Some of the most difficult situations I've had for college students of mine that have gone off is this cycle of using their stimulant to help them study, feeling like they weren't productive enough, skipping sleep, more stimulant. It often ends with a trip to the ER and a medical withdrawal. So, you kind of lose sight of and insight into what's going on when you get into that cycle. So it's just a very dangerous, risky thing to endeavor on. Your sleep is so important.
Can you actually, before you hand the mic, can you define psychosis for people who might not know what that really means? What is psychosis?
Right. So psychosis is when you no longer are in touch with reality. You're having a break from reality, and it is affecting your behavior in a way that's impairing. I've seen people who think like their friends are playing a trick on them, and they get really serious about it, and they're very upset about it. But really, they are hyped up on caffeine, they haven't slept in days, and they really need a good respite and self-care, and nourishment, maybe some medicine to calm down. So, it can really affect you in serious ways, and it's not something to take lightly.
That's fascinating. I've actually never heard that, and I think that a lot of times, especially in our whole culture, there's this bravado of how many cups of coffee you drink and that kind of thing. So, right, exactly. So that's a very interesting comment.
And
Thanks.
faking sleep isn't real, nor is like making up for sleep.
Yeah.
Like the damage is done.
Yeah, I think for me, I just wanted to share my quick kind of recipe for avoiding that this year. I always found myself better, if I'm studying, I'm I have a big test tomorrow, I have all this work, I find myself getting more sleep, feeling way more nourished, not needing caffeine, and performing a lot better when I go to bed at 10:30 and wake up a little bit earlier, rather than trying to force myself to stay up doing non-productive studying, then getting 4 hours of sleep and not feeling good, so I wake up early again. I felt this year I always performed better if I went to bed by 11 and I wake up maybe at 7 rather than 9, and that way I get an extra 2 hours of studying before a test, and I felt always like it worked out better.
Is it safe to take a medicine every night? So what if college student wanted to take a Benadryl every night, or melatonin or something over the counter, is that something that you would recommend, encourage, or discourage?
I think I would recommend you talk to your doctor about it, you know, to really understand like what's underlying that sleep issue and then what would be safe to take and then how that is safe, whether it's a pattern of is this just as needed or do I need to stick with this every night and what are we really addressing underneath. So I think that's a complicated question and definitely talking to a doctor you trust is the way to go.
Great. Yeah, Jenna?
On the flip side of the not getting sleep, I know that there's a lot of people out there that will sleep to like avoid things and they sleep too much. So can you guys speak a little bit to the opposite of that and like how, if you know somebody that's sleeping a lot and you're like, oh, that's kind of not normal, like how would you navigate that?
I'll just say briefly, because I have patients who are struggling with that. You know, first, I think the behavioral part of it is like setting a routine where you have the same wake time and bedtime every night, and that really helps your body and mind know when to be awake and when to be asleep. And then also behaviorally, I think about like, imagine going out into your day and locking yourself out of your room. So you're not coming back to your dorm room. You're going to stay out on campus. You're going to go to your classes. You're going to go to the library to study. You're going to go eat with friends, you know, be around people. And imagine that you have sort of a 9 to 5 or whatever day. Try not to go back to the room if that's an issue for you, you know, getting back into bed. But then also, like, there are a lot of reasons for hypersomnia. So someone with hypersomnia who can't get up in the morning, can't stay awake all day, they're exhausted through their whole day, needs a sleep study. And a sleep study can, you know, help us know if there's obstructive sleep apnea, narcolepsy, or just hypersomnia and we don't know a reason. But then there's ways to intervene medically on that. There are also some ways your labs could be off, like having low iron, things like that can make you tired. So again, talking to a doctor is really important.
So thank you guys. Really appreciate you coming, and I hope to continue this. Thank you, the experts. You guys are awesome, and I love being able to bring you to the people. You know, like you mentioned, Catherine, you know, not going on the TikTok doctors, the people with the best Instagram accounts. You may have great Instagram accounts, Amy Marieskin, but I really pleased to be able to share the knowledge with you guys too.